Hello and welcome to Pregnancy Info. Today we are going to discuss the causes, treatment and each and everything about IUGR, Intra Uterine Growth Restriction. What is IUGR? Intra-growth restriction is a condition where a fetus is smaller than expected for the number of weeks of pregnancy. It occurs when the baby doesn't grow at a normal rate inside the womb, often leading to a low birth weight. Babies with IUGR are at a high risk of health complications both during pregnancy and after birth. The growth restriction can affect the baby's overall development and ability to thrive once born. What are the causes of IUGR? IUGR can be caused by a variety of factors that fall into three main categories: maternal, placental, and fetal. Maternal factors. The health and habits of the mothers plays a vital and crucial role for the growth of the fetus. Some key maternal causes include: number 1, smoking, alcohol or drug use. These habits can limit the amount of oxygen and nutrients that reach the fetus, restricting its growth. Chronic health conditions, high blood pressure, heart disease, or diabetes can reduce blood flow to the placenta, limiting the baby's nutrient supply. Kidney disease, anemia, or clotting disorders. These conditions affect the mother's ability to provide adequate oxygen and nutrients to the fetus. Poor nutrition. A mother's diet lacking in essential nutrients can lead to insufficient fetal development. Infections. Certain infections such as cytomegalovirus, measles, rubella, toxoplasmosis, or syphilis can interfere with fetal development. Certain medications. Some medications, especially certain surgery treatments, can impact the growth of the fetus. Now we are discussing placental factors. The placenta, which provide oxygen and nutrients to the fetus, can sometimes function abnormally, contributing to IUGR. These issues include: number 1, abnormal placental size. A smaller placenta may not be able to provide adequate nutrition to the growing fetus. Placental abruption. This is the premature separation of the placenta from the uterus, which disrupts blood flow and nutrients to the baby. Placental infraction. These refers to the stoppage of blood flow in the portion of the placenta, which can deprive the fetus of necessary growth factors. Abnormal umbilical cord insertions. The placement of the umbilical cord can affect nutrient and oxygen delivery to the fetus. Number 3, fetal factors. Certain fetal conditions can lead to IUGR. These include birth defects. Structural abnormalities such as heart defects can resist fetal growth. Genetic disorders. Chromosomal abnormalities like Down syndrome may be associated with IUGR. Congenital infections. Infections required in utero can affect fetal development. Multiple gestations. Twins, triplets, or higher order multiples are more likely to experience IUGR due to competition for nutrients in the womb. Other contributing factors: high altitude. Living at high altitude can reduce oxygen supply, leading to restricted fetal growth. Preeclampsia or eclampsia. These pregnancy-related hypertensive conditions reduce blood flow to the fetus. Now, what is the way to diagnose the IUGR? IUGR is often diagnosed during a routine prenatal ultrasound. The ultrasound measures the size of the fetus, the amniotic fluid levels, and blood flow in the placenta and umbilical cord. Other diagnostic tools include: number 1, Doppler flow studies. These assesses blood flow in the umbilical artery. Number 2, fetal heart rate monitoring. This is used to assess the baby's well-being. Maternal blood tests. These check for infections, preeclampsia, or other conditions that may contribute to IUGR. Now, what is the treatment of IUGR? Treatment of IUGR largely depends on the cause, the severity of the growth restriction, and the stage of pregnancy. Common approaches include: number 1, close monitoring. Frequent ultrasounds and checkups help monitor the fetus growth and well-being. Managing underlying conditions. Controlling maternal conditions such as high blood pressure or diabetes can improve outcomes. Medications. In some cases, medications can be prescribed to improve blood flow to the fetus or reduce complications from conditions like preeclampsia. Early delivery. If the fetus growth becomes severely restricted or there are signs of distress, early delivery via induction or C-section may be recommended. Home remedies for IUGR. While medical treatment is essential, certain home practices can help support fetal growth in cases of mild IUGR. Number 1. Improved nutrition. A balanced nutrition diet that includes adequate protein, vitamins, and minerals support fetal growth. Number 2. Hydration. Staying well hydrated helps maintain healthy amniotic fluid levels and blood flow. Stress management. Reducing stress through relaxation techniques or light activities like yoga or medications can benefit both mother and baby. Avoiding harmful substances. Stopping smoking, alcohol, and drug use is crucial in preventing further growth restrictions. Frequent rest. Adequate rest and lying on the left side can improve blood flow to the placenta, helping the baby grow. It's essential to follow your healthcare provider's advice in managing IUGR, as professional guidance and monitoring are key to ensuring the best outcome for both mother and the baby. Hope you have found this video useful. If you find it good for the pregnant women, then must share this video with the other pregnant women. That will help her also. So subscribe my channel for such informative videos in the future. Till then, take care and bye-bye.